Welcome everyone to Tuesdays to Your Health. Thanks for being here live in person at Cavallo Point Lodge at the spa here, or some of you that are online on Zoom. It's a pleasure to be here. My name is Brad Jacobs. I have the pleasure to be with Tarika and Lovegarden. Just want to orient you a little bit. We do this monthly, and we have different topics each month. This evening, we'll be talking about meditation and mindfulness and resilience. And we're located here at Cavallo Point Lodge, which is within the Marin Headlands, within the Golden Gate National Recreation Area. Feel pretty fortunate to be here. We're on 80 acres of Cavallo Point within 80,000 acres of national park. So it's always breathtaking to be here. It's a rainy, sort of late afternoon into the evening, and love the beginning of winter weather coming in. So pretty appropriate for maybe what we're going to talking about sort of the weather that comes in both internally as well as externally. So I run a medical practice called BlueWave Medicine. We do this monthly to create community, both in person and virtually. And for those that want to see this in future talks or previous talks, we do post this online on our YouTube channel, currently listed as Brad Jacobs, MD. So love to introduce you to Tarika Lovegarden. She has been practicing meditation and mindfulness for decades, transgenerationally, originally from her father. And so I'd love to hear a little bit of a background. And she gives seminars in lots of different sorts of teaching environments, both locally. She runs seminars here at Cavallo. She teaches classes at Stanford University. So maybe give us a little bit of a background and introduce yourself if you can.
Yeah. Well, thank you for having me.
Yeah, it's great.
So Tarika Lovegarden, my real born name. I was born into meditation, trained since I was a little girl, and have been teaching, like you said, for decades. This particular evening, we're going to be focusing on stress and resilience. So there's different forms of stress. We're going to talk about how does stress affect you personally? What are the symptoms of stress? And then what are some of the stressors in your life? And so it's applicable to you. The first stage is really developing the awareness. Often we're not even aware of when we are stressed. So we're going to go over some of those signs there. And then I'm going to guide you through several, or introduce you. There'll be a shortened version. We're not really going to meditate this evening, but I want to give you an understanding of what we're going to be tools that you can use on your own, the purpose of each tool, different meditation techniques, fairly simple that you can apply to manage the stress in your life or prevent stress from happening. And then the later part of the talk, we're going to go into resilience.
Great. Maybe start with a little bit of background. You spoke briefly, but let's go a little deeper into your training, your indoctrination, your journey, whatever version of it you want to give. Just give a little background to provide some color to who you are.
Yeah, so I'm continuing on with my lineage, I would say, and then adapting it to different audiences, different issues, right? It's not applicable to what we needed even in my lifetime. So it's just mostly focused on life issues. Like this evening, the stress. My particular approach is guided heart meditation. So it's a very guided process. So I would guide groups and individuals into their heart center, teach them how to connect with their inner being, shift from a state of mind into the center of their inner being. So I would say, and I draw from a lot of different techniques. I'm very creative and innovative, and then look to see how people respond and adjust based on that.
Yeah. And if my memory serves me right, you do have a book.
Mm-hmm.
Want to speak to that?
So Meditations on the Fridge is the title of my book. It's a process that guides you through different situations around food to make healthy food choices, become more mindful around food. So that's just one example of how specific you can get with meditation.
Yeah. Can you give us a little sampling of that? So many of us have challenges around food on both sides, right? Some of us undereat when we're stressed. some of us overeat when we're stressed. I'd really love to sort of get your view on maybe even just a short tip or practice right now, like around something around that piece around
Around food. Okay.
yeah.
So the first thing is we want to reconnect to our body's wisdom, right? So someone with a food issue, something as basic as feeling when you're hungry and feeling when you're full is disrupted, right? Because if you've either undereaten or overeaten, you've constantly gone against those natural signals. So then you don't even know what they are anymore. So a lot of the work is in just basically connecting with your body. That's related to the amount. So then you're also going to become more aware of what types of foods you do well with, right? In terms of resilience. If you're eating the right foods, you're going to function better for your body, right? As a doctor, you probably work with people a lot on that and in nutrition. And then on a deeper level, that's what we start with physically. On a deeper level, it would be looking at why we're either overeating or undereating or eating rich foods, craving certain types of foods. What are we trying to either stimulate, pleasure, right? Or avoid, numb out uncomfortable feelings.
Yeah, escape.
Or satisfy a deeper need. And any kind of addiction is actually that.
Yeah, for sure.
So
food is just one of many vices
you're right.
that we have. Yeah.
Yeah. So, and then the guided meditations are very practically like one, connecting with your body, then two, your own intuition. So there's different things around that.
Yeah. And then you also have an app that you built, right?
Yeah.
Maybe share about that.
Lovegarden meditations. So it's a series of guided meditations for lots of different situations, food situations, just meditating in general. Yeah.
Great. So I've used the app. I've recommended this app to a lot of my friends.
Morning meditations, relationships, love, connection.
Yeah, it's been great. I mean, you have a great voice in the app for these guided meditations. I found it really helpful. I've used it. I recommend to friends and members. So I just want to give a little airtime to that.
Thank you.
You can get it on Apple Store
and Google Play. Yeah.
And Google Play. So let's maybe start. Why don't you lead a little bit? I know you want to talk a little bit about stress and so how that affects us. So maybe I can share a slide that we have here. And
so the first step in dealing with stress, I mean, I usually like to give very interactive presentations. So I would ask people, what are your particular symptoms of stress, right? I tend
Why don't we do that?
Yeah. So I tend to get nervous, perspire, heart races, breath quickens, right? Those are the more obvious symptoms of stress. Then there's, so those are physical symptoms of stress. Then there might be emotional symptoms of stress. You might get agitated. You might feel insecure. If it's more stressful, you might cry. That's, escalating the situation. And then there's cognitive symptoms of stress where you might have brain fog or it affects your memory. You can't focus. You're distracted. And then also beyond just the physical symptoms, cognitively, we would look at different mindsets around stress that prevent you from being able to respond well in stressful situations. So those are limiting beliefs, things that get triggered on that front. And then behavioral, like the overeating or going, putting a pillow over your head and wanting to hide or run away, or shopping is another one, watching TV, right? We tend to deal with stress in unhealthy ways.
Yeah, I had a patient today and we were talking and she was speaking into how she loves to shop when she gets stressed. She loves to manage her eating, actually not eat as much when she gets stressed. And how she like focuses on her exercise, will over exercise, undereat, shop, like all ways to manage stress. Which actually a side note, but really interesting and longer conversation is these GLP-1 inhibitors, Ozempic, Wegovy, these weight loss drugs. They've really been really interesting on people's cravings and vices, which is not its indication, but it's been really fascinating. I'm curious about folks that are here in person with us. What are some of your experiences when you get stressed? What do you guys experience? Yeah. So difficulty with sleep, mind turning, can't get back to sleep. Yeah. I have a whole method I do, but you talk about it, but it doesn't happen too often. But when it's happening, I'm like, oh, this is different. I'm watching the mind.
Yeah. And are there particular things that are then keeping you awake, that are stressing you out?
So a lot of people feel that a tightening in the chest or a tension in the body, a tightness in the body, the neck, the head, the throat, Yeah. I think it's really, depending on what you're experiencing, there's different ways to address it through awareness or other sorts of contemplative practices, depending on what people experience, right?
Right. Yeah.
Yeah.
So that's the first, first you're aware that you're actually stressed, right? The physical symptom, or you can't get to sleep. Then we'll go a little deeper into what's causing your stress, like the question of, well, what are the thoughts that are keeping you awake? So then we look at what are our personal stressors, right? Is it financial? Is it a relationship? Is it a health concern? Is it something about your work or your family, right? Those are the typical kids. Kids comes up a lot as a stressor. And then we would look at, oftentimes what's in our power to change. So how could I respond to this situation? And then also work on surrendering and letting go of the things that are not in our control. So there is a bit of a practice with that in terms of the discipline of not feeding those thoughts, like getting on the train of those thoughts, right? If I assess a situation and I really have determined every single thing I can do in my power to change that situation, like completely, then there's a recognition the rest is not in my hands and I let go. So one way of determining that would be to question, are these thoughts that, usually it's a repetitive thought, it doesn't lead to any kind of solution. That would be an indication that this is really not a beneficial this is not a beneficial thing to feed. So, sure, it's hard to break that cycle if your thoughts are constantly going in that loop. But with practice, one learns to just do what needs to be done, then release, let go, and literally shift into another state of being. And that's where meditation comes in, right? Because we're also, part of meditation, when I work with people on stress, we go totally into the stressor, what's causing the stress, what's the disturbance. So we transform the emotional reactions, we would work on shifting mindsets, we would work on looking at it from a different perspective, let's say. And then, so that's more the transformative approach in meditation, which we have to use with stress because there's an issue there. Generally, if we're stressed about something, it's because it really matters to us, right? So you need to bring attention because, there's a reason it keeps going round. And then we also, equally important, will forget about all our problems and just practice going into the center of your inner being. And that's more what we associate meditation with, like the practice of connecting with inner peace, cultivating an inner sanctuary, not focusing directly on silencing mind, but that is a benefit that happens when one becomes more experienced, let's say, right? Like when you first start to meditate, it's natural. You sit and you can't stop mind. That all your energy is in mind. That's all you know. That's where you spend your time, is up in your head. So there is a process of really learning to shift. It's basically, where is your attention? Is it in your head? Or I would guide a person then into their hearts and inner being. Heart, because it gives your awareness a very neutral, non-judgmental quality, which is important because as we become more aware, we become aware of all things, including parts of ourselves we don't like, all our imperfections, negative things, as well as all our strengths and virtues and what's beautiful about us. So heart is really a doorway into the inner being. And it's really, if you think about like our day-to-day life, we're continuously being triggered. The stress response, sympathetic nervous system is pretty much triggered all the time. Like you're in traffic, or you have deadlines, or you come home, and relationship dynamics, family dynamics. And meditation is really this, which I recommend daily, because you want to counteract all that intensity and everyday trigger with eliciting the relaxation response, the sympathetic nervous system. So that happens by breathing would be a good way to transition, right? If you're in a very activated state, you might not feel like silence and inner peace is so accessible to you immediately, right? But the more you cultivate it, the easier it becomes to really shift from a very stressed state into calm, quiet, inner peace.
Yeah, it's interesting. I think a couple things, a whole bunch of things that came up, what you've been talking about. So one piece around it is just the physiologic response. What happens in our physiology? If your mind's doing loops while you're trying to sleep, if our chest is getting tight, if we get sweaty, if our throat tightens. So typically that sympathetic response you're talking about, right? So physiologically, our cortisol levels come up, our heart rate goes up, we start getting a dry mouth, our pupils will dilate or constrict, we'll get sweaty. Everyone has a different method or way of expressing. We get irritable, we get short, we get emotional, but our view narrows. And so to your point, I think the step one in my experience has been to gain the awareness to notice what that is for you, which I think is how you started and what you like to have people do. Because if you don't have that awareness, I have plenty of patients who are like, I'm not stressed out. What are you talking about? I'm like, okay, do you mind if I just record this conversation for a little while and reflect it back to you? And that was me as well, right? But when you're in that row, you don't even notice, right? And you're like, whoa, someone else comes in and they're like, okay, mate, let's take it down a notch. And then in my experience, the first 40 years of my life, I've done martial arts since I was a kid. And moving meditation was way easier for me than sitting. Busy mind, I'm just get frustrated trying to, quote, calm it down. And only later did I learn, it's not necessarily about calming it down. And it's, what about just noticing it, right? Which is, I think, what you were like, take the inventory and just notice what's happening. Mm-hmm. And I think it's really, when we go in those loops, for example, the mental loops, I love your suggestions around noticing them and redirecting, noticing like, okay, I'm doing this loop and I'm not solving the problem, I'm just looping. And literally what's been excited is this thing called the default mode network. Has anyone ever heard of the default mode network? So we map the brain and we see this thing called the default mode. Like the default mode means like it'll just hum like in that network of neurons. We think it's related to teleologically when we always had like survey for predators coming in, mm-hmm. and we had to survey the lands for threat. And so that was always active. We don't have a lot of threats here in America right now. I mean, there are a lot of threats that are sort of existential, and there's, as we know, a lot of war happening as we speak right now. But in our day-to-day, if you're at Whole Foods, how stressed are you really as you buy your, ribeye? And yet we go into this loop. So it's sort of brought from this old days, and it still happens. And so what's been fascinating is to watch, in my experience, to read about these clinical trials that show a reduction in the default mode network when you do meditation. So they randomize people, they do these functional MRI scans so they can map the brain, and they do cortisol levels and a range of other physiologic markers, and they see this reduction in the default mode network, meaning that looping is happening much less. And that looping is associated with psychological rigidity and depression with that rigidity. And there's transcranial magnetic stimulation therapy, for example. Really good. It can focus the beam in a certain way and decouple the prefrontal lobe, what's called the anterior cingulate cortex, and really affect our neurocircuits, which is fascinating. People that are highly depressed or highly anxious. And then we have, that's high tech. And then you've got the low tech of, a daily dose of a minute, 5 minutes, 30 minutes of meditation. So it's really nice to have some practical tips. I really appreciate that.
Mm-hmm.
I'm wondering how would you feel about just doing a short practice with us to give some people some experience of what you're talking about?
Sure. So like the moving meditation is a great way to begin. And then breath, like I mentioned. So there's a very simple technique by Dr. Andrew Weil. It's called the 4-7-8 breath. And it's something that one can do very easily on one's own. It changes your physiology. It shifts your mindset. You'll notice a shift emotionally. So you first begin with exhaling, and you make a... So you can all... We're going to do this together now. I'll guide you. Yeah, so you empty out, and then you close your mouth, and you breathe in for a count of 4. In, 1, 2, 3, 4. Hold your breath. 2, 3, 4, 5, 6, 7. Breathe out. 2, and make the whoosh sound. 2, 3, 4, 5, 6, 7, 8. We do this 4 cycles. In, 1, 2, 3, 4. Hold, 1, 2, 3, 4, 5, 6, 7. Out, whoosh, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Out, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Out, 2, 3, 4, 5, 6, 7, 8. Last breath. In, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Out, 2, 3, 4, 5, 6, 7, 8. So you can see do you feel a difference? Yeah. And it's a simple technique you can use anytime on your own. Then there's other, that's just one example that's more structured, easy to remember. There's other breath meditation techniques. For example, one of my favorite ones is a balanced breath where you're breathing in for 4, holding for 4, out for 4, holding for 4. And the emphasis, and here, this one I recommend not even necessarily counting, but really allowing your focus to be more in feeling the breath physically, energetically. That's already going to bring you from that looping mind into your body, right? The goal is you really want to train your attention to journey somewhere else. Yeah. So the breath, particularly when you let go of the counting, it gives you more capacity to kind of really go into the more feeling, intuitive realms of your own body, energetically, emotionally. The in-breath is really the breathing into life. You're expanding into life. That's the purpose of the in-breath. The hold on the in-breath is maximum intensity, engagement, contribution. You're connecting with your strengths, your virtues, how you're pouring back into life, let's say. And then the out-breath is letting go, but also the out-breath takes you deep inside. So part of what we're practicing in meditation is, our awareness is very much focused outwardly on people and situations and circumstances and what do I do and so the practice of meditation is you're developing internal awareness. Now I realize most people that don't meditate kind of their initial response is often, I close my eyes and I'm journeying into my soul. What? There's nothing in there, but there is. So the out breath, you'll get to know that as you meditate and practice. The out breath is not only releasing, but it takes you in, and then that pause after the out breath is, in my view, the most important moment of this. I'm just describing now one cycle of breath, but you could do this for 20 minutes, 30 minutes, just this simple meditation technique.
And people call that the still point. Is that the?
I mean, I've labeled it still point. I've labeled it the gap. Be in the gap. So in that out breath, everything is emptied out. It's sort of almost like a mini death. And it's the greatest opportunity to dive deep into emptiness and silence. It's like a feeling of time stops, which is what you need to combat stress, right? Or for resilience. When we talk about resilience, on a physical level, on an emotional level, on a being level, you replenish from that gap, right? We're so focused on doing and having and chasing and desires and more, and right? And we're not really taught as a culture that there's tremendous value in taking time every day to do nothing. I mean, not even meditate, but just do nothing. Like if you want to stare at the ceiling or whatever, you need mind to rest. You need all activity, everything to just stop. But also, you think it's like emptiness and a lack, but it's not.
Yeah.
The deeper you go into emptiness and silence, the more full. That's where you get really blissed out. When the meditators talk about.
I'm curious, at the end of the exhalation, do you ever explore, expand that space? So, as you slow your breath cycle down, do you find yourself then expanding the length of time that you're in that full exhalation?
Yeah, I would. That's why the counting is loose. You don't want to be confined. Yeah, by the time. So and sometimes you barely want to breathe in again, and it's not so tied into the physicality of the breath at this point. So maybe I'm physically breathing, if you would measure as a doctor, right? I'm physically breathing, but I'm like energetically in that gap.
Yeah, quiet.
Yeah,
subtle
in
breathing.
My consciousness.
And I just want to share, since you sort of gave me the door to open the door a little bit. When we do our breath, the inhalation, exhalation, we use our diaphragm. Particularly the whooshing is like you're engaging that diaphragm. And to engage that diaphragm, it's a muscle. It's innervated, and it's innervated by the calming part of our nervous system, the parasympathetic. So, which is the vagus nerve, the vagal nerve. So it's no wonder that that exhalation with a whoosh, and there's so much energy that both in the yogic traditions and in a lot of the Buddhist tradition, many traditions that are contemplative oriented, focus on the breath and that oscillation, and you get the background, that sort of back pressure that you do on the exhalation relates to really energizing or invigorating that parasympathetic side, the calming, the break side of our nervous system. I just find that, fascinating. And if you think about a sigh, people like, right, that long exhalation. Why is that? So there's a lot when you think about. So it's really interesting for me to also the blood flow, right? So as you breathe in, what happens? You breathe in, and there's less blood flow coming back to the heart, and as you breathe out, more blood flow comes into the heart on the return. So there's all these physiological shifts that happen just with our breath, which is so amazing.
Mm-hmm.
And you feel them, to your point, like at the deep level.
Mm-hmm.
Forget about sort of the science or the objective science, but the internal science, the internal milieu, the investigator within you notices a whole bunch of stuff.
Yeah.
So what do you notice as you play with breath in your experience?
A lot. Yeah, I mean, every meditation I guide is somewhat centered on the breath, so we use it as an anchor. And then even in the example that we just went through, there's no end to that journey. We also referred to that when we talk about centering meditation. You have deeper access to it, and it becomes your natural resting place of being. And then when you're not centered, it becomes more and more obvious, and then you quickly return to that. And then also the other thing I noticed years ago, and it actually took me a while. It was only about 5-6 years ago. And it was like this epiphany, this discovery I had, is that when you go deep enough into the center of your inner being, you're connected to the source of life itself. Like you just dissolve there. There is no Tarika, there is no Brad, right, at that point. And that's what we're seeking, as humans.
Yeah.
To return into the whole, become one with others, with life itself, one within ourselves, right? A lot of stress arises from being disconnected to our values, to what's important to us. So we get pulled in a lot of different directions without even thinking, well, what do I really want, or what do I really need? Or a lot of stress arises, for example, from a conflict in values. So I say yes to something over here because it is important to me, but then something else over in another aspect of my life suffers because of that decision. So a lot of meditation also, we talked about in your center, in that gap, that's sort of the deepest level, but we have to do a lot of work along the way, both inward, on our journey in, we go through a lot of different layers, and then on our journey back out, we go through a lot of different layers. So, for example, the work on connecting with what's most important to you, right? And being very laser focused on prioritizing and not taking on more than what you can commit to, and not feeling stretched, not stretching ourselves too thin, because we're really maximally pouring into what is most important to us.
Yeah, it's really interesting. What comes up for me as you're speaking is around health professionals and what we call moral injury. Have you guys heard that term, moral injury? Which relates to the morality of our healthcare system, and how the moral injury by the health professionals are feeling because they know that it's an unjust system that's broken, that doesn't do right by their patients. And they came into medicine for that. And so you talked about values and, acting in certain ways that are not aligned with their values. And, there's, I think the latest survey showed 73%, I think it is, of health professionals, physicians are burnt out.
Yeah.
That moved from 40 to 70% since COVID. And so that's, and the burnout, the 2 to 3x suicide rates, the 2 to 3x depression, it's a crisis. And as people check in more and learn to check inventory, they learn to maybe this isn't the right profession, or they need to leave and do it differently, like we do it here at BlueWave Medicine.
Well, also, there's also with healthcare providers, you're constantly caring for everyone else.
Yeah.
That comes up a lot, with my clients that I work with, and they really can't even take care of the basic things of making their lunch because they're so pouring out into others. I think that.
Yeah, or eat their lunch even if they figure out how to make it.
That's right. That's right. Yeah. Okay, so here's another body one because it's easier. A progressive muscle relaxation technique, which is focused on releasing physical tension. Again, whatever technique we use, you can go much deeper with. So you're not only releasing tension by actually exaggerating it, like, as we mentioned earlier, both of us, we weren't aware, all of us aren't really aware of how stressed we are. We're also not aware of how tense we are in different parts of our bodies. So the practice of exaggerating that tension brings greater self-awareness, and then also it creates a contrast and a momentum for the release. So this technique is a perfect technique to teach you how to relax. It sounds like a very basic thing, yeah, but we need to learn how to relax, like when we have to go to sleep.
It's interesting. So this, for a moment, the nice thing about this practice, the progressive muscle relaxation practice, is you're active, So it gives you something to focus on. I think of it as like a focused meditation.
Yeah.
And in my experience, I'm curious about yours, but people that aren't used to meditating, the only time that people calm down and like chill out and relax is when they're going to sleep. So I've had so many people that we do meditation and they're out, and they say to me, I've been doing this a year and I just fall asleep. Do you want to speak to that before we go into this?
Yeah, no, it is a common experience for people. And what I say to that is it's natural, right? We're not used to connecting with very deep states of relaxation. The practice of meditation is then to be relaxed and alert, which develops over time. But I think it's because we're so exhausted when we stop. Yeah, I mean, I think it's just overexhaustion, but it does, and there is benefit. I often will say, keep going. If you fall asleep in a meditation practice, keep going. Your subconscious is still listening. It's nurturing the pathway into your inner being. So there's still benefit to that. And if you're really that exhausted, then you need a nap.
Yeah. I also think it's a conditioning. I'm literally like most of us, even if you're rested, if you're a napper like me, and you're rested, but the conditioning is I don't relax. And so unless I'm going to sleep, that's the only time I relax. Like to what you were saying. The same thing for acupuncture. I don't know if those have done acupuncture, but a lot of times people or massage, they just fall asleep. And they say, oh my God, I feel so rested. When they wake up, they're like, it's great. So this is different. So we're going to do a focused meditation, progressive muscle relaxation. So,
okay, do we want to do this practice?
Yes.
Okay. So the last thing I want to say, even though we're using the body to learn how to relax, which is the primary focus of this technique, I want to invite you to also discover what it's like to let go.
Mm-hmm.
So that's another area.
So what's it mean? Relax versus let go.
Yeah, I know. Well, we hang on to things, right? The chewing, you're basically, there's something generally, if thoughts, if there's incessant thinking, or there's the looping that we talked about, replaying certain things, it's fueled by unprocessed emotions. Otherwise, mind, you've noticed there's many different types of thoughts. maybe I sit down to meditate and my mind just wanders over here or over there, or I forgot about something I had to do, or what am I going to buy at the grocery store, whatever. There's not a lot of there's not a lot of charge, and it's just kind of what to do, and okay, I got distracted momentarily and now I'm back in my breath or my body, whatever the technique is. But there's, if it's the incessant type of thinking that really we keep getting caught and jump on the train, and then oftentimes you don't even realize you're caught. You're like, whoops, meditation is over. I was just the whole time.
Yeah.
So that's an example of where we would practice letting go of some of our attachments or emotional charges, wanting things to be different, right? There's a lot of, in relationships, that's an area. There's a lot of expectation and disappointment and blame, and a lot comes up in that, for instance, but not only in relationship. It could be in life. Things are not going the way you want them to, and you're holding a grudge against life itself, let's say. So those are just some examples of where letting go is really, really beneficial, and especially coming back to stress and resilience. Resilience, one could say, it all comes down to being able to let go, right? To bounce back from hardships, or let go of disturbances that keep bothering you.
Or reframe, maybe.
Yeah.
Right?
That
Reframing.
also.
Yeah. Reframe your perspective.
Yeah. We do a lot of work on that as well. So the letting go, or, with stress, with the example of doing whatever you can do that's in your power to change, and then the surrendering to what's not in your hands, right? There's so many things. So those are examples which, when you practice this progressive muscle relaxation technique, in the beginning, you might not be so aware of this, right? Today, you might be more focused on the physical relaxation, but I always like to mention it because there's really no end even to the most basic, simple. This would be in the category of a very basic, simple meditation technique. You can take it all the way to letting go of grudges and disappointments and expectations and all the things, right? Because you're really just, even though it's a physical thing, everything's so connected, right?
Let's do it.
Yeah. Okay. So you have an option to close your eyes. And then we're systematically going to tense up, like exaggerate tension in different parts of our bodies in each muscle group. And then we're going to hold it for 5 seconds. So there's tight, 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 hold, and then relax for 10 seconds. Now, I'm not going to be perfect on the counting. I think we want to just go more into the experience of it. And you can do this, if you do it on your own, you could begin with the bottom part of your body and move up through the muscle groups. We're going to actually do it first with the right arm, the left arm, then we're going to go into the face, all the places, like the jaw, the eyes, the forehead, all the places where we carry a tremendous amount of attention, the neck, the shoulders. Then we're going to go down into the abdomen, then we're going to go into the pelvic area, and we're going to go into the thighs, lower legs. Okay? And we'll do right side and then left side. Okay. So you might want to make a fist and sort of like pull your forearm into your bicep, tense the whole right arm into your shoulder, tighten it as much as possible, tighten, and then release, let it go. And we're going to do the left arm, making a fist, tighten your arm, tense, even more inside the bicep, all the muscles in the tricep and the shoulders. Tense, 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 tense. Exaggerate the tension. Feel the holding. And then release. Then start to tense up your jaw. You might want to clench your teeth and all the muscles around your cheeks, your eyes, like making all those faces like you don't like what's happening, like the normal expressions on your face, just exaggerating them. Tense, 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 tense. Then release, let go. And then tensing up your shoulders and your neck. You might want to tilt your head up so that you're really closing the gap between the back of your head and your shoulders. So you're tensing up that whole area, exaggerating the tension. Feeling where you normally hold the tension and exaggerating it even more, even more, even more. And releasing, letting go. And then going down the body, feeling the belly, tensing up the solar plexus, the belly, maybe pulling your belly in, tightening all those muscles. Tense, 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 tense. You can barely breathe. And release. And then tensing up your buttocks, your pelvic area, all those little muscles, squeezing in. And releasing. And then tensing up the right leg, the whole right leg, also the bottoms of the feet. You might want to even curl your toes up a little. Tensing the calves, tensing the thighs. Tense, 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 tense. And release, let go. And then doing the left leg. Tensing up, exaggerating the tension. And releasing. And then taking 3 extra long, deep breaths to release any residual tension or stress. And then opening your eyes whenever you feel ready.
So I'm curious what people notice. So do you ever recommend, like I found myself after our conversation and doing this practice, I don't normally do it this way, but I brought in emotional content as I was tensing.
Mm-hmm.
I brought it up emotional content, and then consciously, when I released my arm, let go of that emotional.
Yeah.
After sort of hearing what you said, I did that, and I found that really interesting.
Yeah.
Yeah.
Awesome.
Yeah.
Well, thank you for doing that.
Well, you prompted it.
I know, but normally people don't listen.
There's that. And I was also curious about breath. So what do you do with your breath during this time? Like you're tensing? Do you need to, should you be managing your breath? And when you let go, is your breath any different?
Yeah, I think you probably hold your breath when you tense up and then breathe out, release when you let go.
So does it matter what we do with our breath? I guess that's my question. Is there any sort of management we should be doing when we're doing this practice?
Yeah, I wouldn't recommend any, just whatever happens
Don't overthink
naturally.
it.
Yeah.
Okay.
I mean, whatever, you could experiment with it. Like you're a curious type, right? So you might find things in this technique that I haven't found, for instance, right? So that's a good example. Like we use techniques, we don't stay too strict with the technique. We experiment with techniques and then use it how it works for us, right? So you already had a whole process with the technique, and that's actually how one should use a technique. Even when I guide meditation, it's very invitational, and then the person really should just go on their own journey with whatever comes up, whatever arises, however it's useful for them.
I think one of the other pieces I'd like to share that's coming up, as you said this earlier, like the nice thing about this progressive muscle relaxation, and sometimes you start from the bottom up, I think you wrote here, um, or spoke to, and we're so, like you said earlier, we're so top down in how we process. Like we walk through the world, and as a physician, I'm very reliant on my intellect and my knowledge, and so I'm processing from the top down, and I walk through. I'm interacting at a very cognitive, intellectual level, and reading cues and signs, versus walking into the same room or same conversation from a bottom up, from a ground up experience. What does it feel like in my body? What am I noticing as I walk into the room? What's my gut instinct? What am I noticing? As I breathe, if I breathe through my chest and heart, you talked about focusing on the heart. What do I notice as I'm breathing from that place and allowing my mind to relax and just receiving, perceiving, not through necessarily my eyes and ears, but perceiving through what I'm feeling within my body as I'm breath. And I think in my experience, the breathing practice can help me drop into the body and then perceive from the body what I'm noticing. And it's much more amorphous. I think in the beginning, you may not notice anything. Eventually you may notice subtle things in your own body. And is that your own stuff? Are you reacting to someone else's stuff? Is it from their stuff? There's all this complexity, but it's a whole different way to walk through the world and experience things. I found it really exciting because it's like a new sensory organ. So I'm curious about your experience around that.
Yeah, I mean, I like how you describe that. This progressive muscle relaxation technique or body mindfulness, also known as body scan, you're awakening your sensitivity of feeling by feeling the body or through feeling the breath. And then that same sensitivity enables you to perceive internal states through feeling, because we don't look. I mean, there is an element of looking, but a lot of meditation is feeling. So sensing, yeah. But you also you open the door through the physical sensation, then you feel emotional, and then you feel even deeper into the values, the virtues of life, or your own strengths, your own nature. And a lot comes through feeling. Like a lot of times my dad would guide me into these deep states of meditation, and he goes, "So what did you experience?" I'm like, "Well," because you're going into dimensions beyond cognition. So there are no words actually when you go deep enough. And then you learn to be able to articulate the undescribable, but the actual experience afterwards, after the fact, but the actual experience is sensing, feeling a lot of times.
Sensing.
And then we also use, there's a lot of different visualization techniques. I chose these particular techniques today because I wanted to give you all something very simple and easy to use that you would remember and be able to use on your own in many different situations to disrupt the stress response or transform your state. But we might also use visualization, or I guide a lot on listening.
Yeah.
So we incorporate all the senses actually, typically, in a guided meditation.
Well, Tarika, we're at the end of our hour. I want to thank Tarika Lovegarden for joining me. You could tell this is just a superficial layer of the depth of knowledge and experience that you have. So it's an honor to be with you.
Thank you.
And together like this. It's fun to have you both have some planning and also be spontaneous in how we explore this conversation together. I invite you to check out her app, Lovegardens. I think it's called Lovegarden.
Lovegarden Meditations on iTunes the App Store or Google Play. Yeah.
Yeah, and also her book as well. And we'll invite her back. If you have questions, feel free to ping us, and feel free to come next month. I'll be giving a talk speaking around the 6 pillars of healthy living and taking action to sort of redesign your life. We have several other guests coming in the next several months. So we welcome you. If you can't make it at the hour that we show up, and life is quite asynchronous these days, feel free to find us these talks archived on our YouTube channel. So thank you for coming in person and on Zoom Live. Have a good evening.
Good evening. Yeah.
I hope you enjoyed the show today. We really learned a lot. If you feel compelled and want to learn more, please feel free to go onto our website and subscribe to our newsletter, as well as come onto our contact list. That'll allow you to get informed about future webinars as well as our upcoming retreats, and you'll have an individualized program to get the results you're looking for to optimize your health and your health span. Thank you for joining us today.